I am very happy to talk about my childhood. In childhood, we were 11 people staying in a room of this size. And I used to go to the library and study in the library. I used to sit under the lamp and read. Now I will tell you, truly, poverty is a virtue for if you want to do hard work. If you are rich, you got all the money, you got all the books, but you got no time to read. A poor person brings the books from the library. He makes notes, he learns to write, he learns to reproduce, and he becomes a scholar. And I studied in municipal school. Now municipal school is the lowest cadre, where you sit on the floor and write on a slate with chalk. Now it has changed to computer age. Then I went to school which was a vernacular school, Urdu school. Now Urdu school also, people think that they cannot progress. Urdu medium school means you cannot progress. But if your parents are interested, my father was a registrar of the Bombay High Court. He used to teach me English, and his rule was every night before dinner I have to memorize and reproduce 5 words from Times of India, and then only I'll get my food. Otherwise I will not get my food. This is the hard way I came up. Then I went to Elphinstone College. That time Elphinstone College is one of the best colleges in city of Bombay. There I went to Grand Medical College. In Grand Medical College I decided that I will do something for myself and make a name for my family and for my country. And there I got so many gold medals. In fact, in the Master of Surgery examination, there were 4 gold medals, and all 4 gold medals were given to me. I even got the Prince of Wales Fellowship. I had decided to go to England. Now I went to England with only 3 pounds in my pocket. You'd be surprised that how I went there, because I had that zeal to work, and I got the job immediately because of my past record of doing so many operations. And after coming from England, I worked in Mahatma Gandhi Hospital for 1 year, and then I joined Grand Medical College. And my whole history is there before you. But I decided that I will serve my countrymen. I could have stayed on and on in England and rose to great heights.
Hello, this is Pranali Meher. As we know, India is already termed as a diabetic capital of the world. We see many diabetic patients developing diseases like kidney disease, blindness, and leg amputation due to untreated diabetic foot. Dr. A R Undre has saved many diabetic patients from amputation by providing proper education, counseling, and treatment well in advance. Today, Dr. A R Undre is going to reveal simple methods and precautions to be followed by diabetic patients in these regards. Hello, Doctor. Thanks for joining us today for this interview. Today, we would like to know about diabetic foot and your novel way to save the foot from amputation.
I am very excited about this topic because we see many people losing their feet. The legs are amputated and they don't live long. And it is totally preventable. Diabetes is rampant all over the world. India will soon become diabetic capital of the world. And people like to eat, and they like to eat sweet. They're supposed to have white sweet tooth, but there are many other things that they can eat. And they should be particular about the diet. Now, like mango, you should not eat mango. Not even once, not even a bit. Banana you should not eat. Chiku you should not eat. Custard apple you should not eat. Panas or jackfruit they should not eat. White bread they should avoid because brown bread is available. And rice should be taken in small quantity, at least like half a wati in a day. And if they take particulars, they can live a normal life as long as any other normal person.
Doctor, what are the current trends in the treatment of diabetic foot?
Many diabetologists are only interested in looking at the blood sugar and their finger. They ask them for the finger, they take the blood sugar and they write down what things to eat, what not to eat and tablets. But they have got no time to look at the feet. The feet is the most important thing. First they lose the sensation. Once they lose sensation, if the prick is there, a nail hits the foot, there will be an ulcer and that will progress to gangrene. And once the gangrene occurs, it goes on spreading. Even if gangrene occurs by way of CO2 laser, we can prevent spread of gangrene.
Doctor, what are the precautions to be taken by patient to avoid developing diabetic foot?
Strict diet, meetha bolo, meetha khao mat. Talk sweet, don't eat sweet. And that is something nice. Everybody wants to talk sweet. But eat sweet, no. Don't eat sweet.
Doctor, what is the first thing which diabetic patient need to do when his or her physician tell him that he or she has developed diabetic foot?
They don't have time to tell about diabetic foot. Diabetic foot patients should look after their feet. They should not walk barefoot. They should not go to temple without socks. They should wear white socks. And white sock is compulsory for all patients because slightest drop of blood you will be seen on the sock by the maid or by the daughter or the wife and they can be treated immediately. Don't neglect a smallest ulcer on the foot.
Doctor, we generally see around that in case of diabetic foot which develops gangrene need to be amputated, giving the long life disability to the patient. What is your way of saving the foot in the unfortunate diabetic patient?
Diabetic gangrene doesn't develop suddenly. It develops slowly. If one toe is bad, you can remove one toe. So you should attend to the diabetic foot immediately. Many doctors also lose heart and they say no, we have to cut the leg. If you cut the leg, that means you are writing his death certificate. He will die within 1 year because he loses the desire to live. So do minimum a conservative amputation. I'll give you an example of a mango. A mango, a top becomes little black. You can cut the top portion and put in the deep freeze and eat it next day. So deep freeze, it is CO2 laser is like the deep freeze, and it will prevent spread of gangrene. And person once he loses one toe, he gets the idea that his body is not to be, he has not to lie in inches. He has to live a normal life for himself, for his wife, for his daughter, for his children.
Dr. Undre, we are thankful to you for giving this valuable information to our patients. I'm sure this information is going to save many diabetic patients' foot from being amputated. We thank you, Dr. Undre, to allow us to take your interview. We wish you long life and lots of satisfaction from the work of humanity being done by you since last 50 years.
Thank you.
મારું નામ મધુબેન જગદીશ રૈયારેલા. હું ડાયાબિટીસનું પેશન્ટ છું. જ્યાં આજે 8 થી 10 વર્ષથી મને ડાયાબિટીસ છે. જ્યારે એકદમ ડાયાબિટીસ હતું, 700-800 જેટલું ડાયાબિટીસ હતું. મને ડૉક્ટરે કીધું તમને પેરમાં બહુ જ દર્દ છે, તો તમને પગમાં દર્દ છે, તો એના કારણે તમારે પગ પણ કાપવો પડશે. એટલે મને બહુ અંદરથી તકલીફ થઈ. ત્યારે હું સાહેબ પાસે આવી, અહીંયા મુંબઈ સેફી હોસ્પિટલમાં આવી. એટલે મને આ સાહેબની મને મુલાકાત થઈ. એટલે સાહેબને મને કીધું, ડૉક્ટર સાહેબે, કે તમારે કાંઈ પગ કાપવાની જરૂર નથી, તમે મારી દવા વ્યવસ્થિત રીતે ચાલુ રાખો. આજે 7 થી 8 મહિનાથી હું સાહેબની દવા લઉં છું, તો મને ખૂબ કંટ્રોલમાં આવી ગયું છે. 100 થી 20 જેટલું થઈ ગયું છે ડાયાબિટીસ. પહેલાં 700 થી 800 જેટલું ડાયાબિટીસ હતું. ત્યારે મને બહુ તકલીફ થતી હતી. મને એમ થતું હતું મારો પગ કાપવો પણ પડશે તો શું થશે. તો ડૉક્ટરે મને કીધું, નહીં, તમે કોઈ જાતનું ટેન્શન નહીં લો, તમારે કોઈ જાતનું પગ કાપવો નહીં પડે, તમે મારી દવા વ્યવસ્થિત રીતે ચાલુ રાખો. સફેદ મોજા પહેરો, ચંપલ પહેરો અંગૂઠા વગરના, અને જમવામાં પણ તમે સ્વીટ નહીં લેતા, કાંઈ પણ વ્યવસ્થિત રીતે જમજો. કે તમે જે હોય તે કાચું ફળ ફ્રૂટ ખાજો, કાચું ખાજો. કોબી, કાકડી, ટમેટા, ગાજર એવું મને સાહેબે કીધું. ને તમે ફ્રૂટમાં પણ કે તમે કેળા કે કેળા કે કેરી એવું કાંઈ પણ ન લેતા. મોસંબી લેવાનું કીધું સાહેબે, જામફળ લેવાનું કીધું, એવું લેવાનું કીધું સાહેબે. પણ વ્યવસ્થિત રીતે કીધું કે તમે કંટ્રોલમાં જ લેજો, જે લ્યો તે એકદમ નહીં લેતા. જો જમવા બેસો તો તમે કંટ્રોલમાં જ જમજો, બહુ એકદમ હેવી નહીં જમી લેતા, કે જેથી કરીને તમને ડાયાબિટીસ વધી જાય. બહુ જમવાથી પણ ડાયાબિટીસ વધી જાય છે. મને પહેલાં બહુ જ ભૂખ લાગતી હતી એકદમ. જ્યારે હું જમવા બેસું તો બહુ એકદમ જમી લઉં. પણ જ્યારે સાહેબ પાસે મુલાકાત થઈ તો સાહેબે મને કીધું, નહીં, નોર્મલ રીતે જ જમવાનું. દિવસમાં 3 વાર જમો અથવા 4 વાર જમો, પણ શાંતિથી અને ચાવીને અને વ્યવસ્થિત રીતે જમવાનું. એટલે એના કારણે તમારું ડાયાબિટીસ એકદમ કંટ્રોલમાં રહેશે. આ જ રીતે ડાયાબિટીસ મારું કંટ્રોલમાં છે. એનાથી મારા પગમાં પણ તકલીફ નથી રહેતી હવે. અને ડૉક્ટર સાહેબે મને કીધું કે હવે તમે કોઈ જાતનું ટેન્શન નહીં લો, તમારો પગ કાપવાની કોઈ ચિંતા નહીં કરો, હવે એકદમ નોર્મલ થઈ ગયું છે. હું ખૂબ સાહેબનો આભાર માનું છું.
मेरा नाम खुर्शीद शेख है, मैं 69 ईयर्स ओल्ड हूँ. मुझे डायबिटीज़ में हाई होने की वजह से मुझे ग्लैंड आ गया था, जो मुझे बहुत तकलीफ दे रहा था. मैं बैठ नहीं सक रही थी उसकी वजह से, ना सीधा खा सक रही थी, ना पी सक रही थी, ना लेट सक रही थी. लेकिन मैं यहाँ पर जब आई डॉक्टर साहब उंद्रे साहब सेठी हॉस्पिटल में, डॉक्टर उंद्रे साहब से मिली, जो उन्होंने मुझे ट्रीटमेंट दिया, मुझे मैंने ऑपरेशन किया. उन्होंने मुझसे 4 दिन में मुझे उन्होंने बिल्कुल ठीक कर दिया. मैं उनकी शुक्रगुजार हूँ कि मेरा उसकी वजह से आज मेरी तकलीफ दूर हुई. मैं आज बैठ सक रही हूँ और मैं अच्छी हो गई हूँ माशाल्लाह. और डाइट कर रही हूँ, मीठा नहीं खाने का, मीठा बोलना लेकिन मीठा नहीं खाना. डॉक्टर की नसीहत है, मैं उस नसीहत पे अमल कर रही हूँ.
My name is Arun Lazur. I am 41 years of age now. I was diagnosed with diabetic in 2013. In 2014, I developed a foot infection for which I came and visited F.A.I.M.S hospital. Here, the first time I saw Dr. A R Undre, who was told by the other doctors that he will be doing your surgery. That is the first time when I met this gentleman and the best doctor whom I've ever known. The first day only my surgery took place and one toe had to be amputated, which was done. Then later on they realized that the infection had spread to the sole of the feet also. And I became very nervous when I was told that the infection is spreading. But doctor assured me that they have a new technique which has come up here. He's introduced in F.A.I.M.S hospital, the CO2 laser, and not to worry at all. So what was done is I went through 10 to 12 CO2 surgeries for the infection to stop. So as a result, what happened is the sole of my feet was cut, but they saved my foot. If I had gone somewhere else, I'm sure this is what my friends and relatives told me, that they would have amputated at least half my leg, and my life would have been no more. I wouldn't have been here to record this video. But I'm grateful to Sir Dr. Undre sir, who gave me a second life actually, because that's the reason I'm here. And he always suggested, what he said was, after my surgery was over, I was here admitted for almost 2 months. In this 2 months, as I said earlier, I went through 12 CO2 laser surgeries conducted by him. And after that, there were dressings done every alternate day. Then the wound healed. Then I was discharged from the hospital. I walked on crutches. And I had actually lost hope completely that I would ever walk on both my feet. But the doctor always gave me the assurance that don't worry, one day you will walk. And after a year, my wound healed and I was able to walk on both my feet. After I was discharged from the hospital, I came for regular visits and I was advised by doctor, don't eat sweet but only talk sweet, and that is what I follow now. He also advised me to wear white socks. What happens is, because I don't have sensitivity on my foot and my leg, if I get a prick or I hurt myself without knowing, it can be detected in the white socks. That exactly happened when I went through my second surgery. I didn't know what happened. My wife saw some stains on the socks and she asked me, then she saw my leg and there was a small hurt. So immediately when something happens, I rush to the doctor, he gives me some antibiotic and then I'm okay. So right now I am leading a normal life. My sugar level is in control with tablets, and this would have never been possible if I was somewhere else. And thanks to the doctor who took care of me and did all this. So I really want to thank Dr. Undre sir once again.
Now Mahatma Gandhi used to say that if India has to progress, the village has to progress. Prime Minister Modi says, adopt one village. He tells his ministers, adopt one village. I have adopted 14 villages and they're all English medium schools. But along with English medium school, we are teaching vernacular language because mother tongue must also be taught. And they are doing very well. Many of them have scored marks in the merit, in the board exam, and even in the university exam. And many of them are gone abroad, various countries, Dubai, England, South Africa and all.